Hi, Assalamualaikum. Today, we are from FOAS12039. We will present about COVID-19. The question given is, COVID-19 outbreak is on the loose and become a global pandemic. How can such virus attack the human immune system and health? How vaccination could play a role in curbing this outbreak? But first, let's meet our team.
Hi, my name is Nurhafizah binti Gani.
My name is Natasha Narisha binti Abdul Halim.
Hi, my name is Siti Nuralia Maisara binti Zulkifli.
Hello, my name is Amira Tasha binti Raslan.
My name is Maisara binti Jamuluddin.
In this video, we will talk about introduction, immune system, how can such virus attack the human immune system and health, how vaccination could play a role in curbing this outbreak, and reference. First, introduction. Coronavirus disease, COVID-19, is a disease that highly contagious and can spread very quickly. The first case was identified in Wuhan, China in December 2019. There are three symptoms of COVID-19, which is serious, most common, and less common. Firstly, serious symptoms such as shortness of breath and chest pain. Secondly, most common symptoms such as cough, fever, loss of taste or smell. Thirdly, less common symptom, which is headache, irritated eyes, sore throat, and rash on skin. Now, we will talk about how to prevent coronavirus disease. First, we have to clean hands frequently, keep a distance from others, getting the vaccine, avoid crowded public gathering or activities, and wear a mask. There are 4 types of COVID-19 vaccines. First, messenger RNA, mRNA vaccines. For example, Pfizer. Next, viral vector vaccines, such as AstraZeneca. Other than that, whole virus vaccine, which is Sinovac. And lastly, protein subunit vaccine, which is Novavax. Secondly, immune system.
Active immunity results when exposure to a disease organism triggers the immune system to produce antibodies to that disease. Natural active immunity. First, when a person is infected with a pathogen, the lymphocyte cells will produce antibodies in response to the antigen. Next, when an individual recovers from an infection, the individual will acquire permanent immunity against the disease. Lastly, if the same individual is attacked again by the same pathogen, the lymphocyte cells that store the memory of the pathogen, which are memory cells, will quickly produce antibodies to act immediately against the antigen.
Next, we have artificial active immunity. It is an immunization process that stimulates immunity against a specific disease through vaccine injection. This is different from natural active immunity, which occurs when a person is infected with the actual disease and recover, providing them with long-lasting immunity against future infection. When a vaccine is injected into the body, the vaccine will stimulate lymphocytes to produce antibody to fight pathogens. The first vaccine injection will usually result in a low level of antibody production, which is insufficient to protect an individual from the disease. A booster dose must be administered to increase the antibody production to a level of immunity that can protect the individual from the disease.
Next, how can such virus attack human immune system and health? The main route of virus entry is respiratory droplets that are expelled and absorbed by the mucous membrane, especially the nasal and larynx mucosa. COVID-19 spread readily via person-to-person contact. After a week, some patients with mild symptoms at the beginning may progress to more severe symptoms. Older people have high risk to more severe effect from COVID-19 because their immune system declines with age, making it difficult to fight off infection. There are three stages of SARS-CoV-2 infection. The first stage is when a person has slight infection and showing mild symptoms. The virus SARS-CoV-2 attacks the host by latching onto a protein called the angiotensin-converting enzyme 2, or we call it as ACE2 receptor, which is located in the lungs and intestine. A person will develop a cough if the virus is established in the respiratory tract, while in the gastrointestinal tract will cause diarrhea. In this stage, the virus multiplies rapidly in the infected person's body. The next stage is when the virus attacks the immune system, thus disabling its function. The virus replicates too fast that make it the immune system unable to control it. This phase, also called as pulmonary phase, resulting in formation of blood clots and respiratory condition like shortness of breath and intense coughing. The last stage is called the hyperinflammatory phase. The immune system goes haywire, attacking the virus aggressively that it does far more damage than the virus itself. The body's response to the virus starts to limit the organ system because the heart and kidneys starts to become dysfunctional. Once it is in a stage of multi-system organ failure, it can lead to death.
That's how vaccination could play a role in curbing this outbreak. Vaccination can assist important decision makers in taking necessary action or measures to contain or limit the spread of the coronavirus and in making more sensible decisions. There is three ways of how vaccination could do this. First one is disease prevention. Disease prevention will stop the virus from spreading, in which vaccinated individuals nearby shield the uninfected from illness since they are less likely to come into contact with the virus. Next, the herd immunity mechanism. By boosting the population of immune people, the virus has fewer susceptible individuals to infect, reducing its ability to spread within the community. The last one is the genetic stability. The risk of virus mutation is reduced by vaccination, which reduces the likelihood of new variants emerging that can spread to the people.
That's all from us. Thank you for watching.